Talking with Jazz today about exercise physiology. So they're a really important part of what we do here at o-health and one of the points of difference that we have. And so we're keen to clean up a few myths about exercise physiologists. So Jazz, how long did you go to uni?
I went to uni for 4 years. I did a Bachelor of Exercise Science and then I did a sort of compressed master's degree in clinical exercise physiology.
Yep, so you've got a master's in exercise physiology. Why did you do EP?
I wanted to do EP since I was in year 10. I did a personal training course and loved it, loved working with people, was really passionate about the health and exercise side of things and wanted to expand on my knowledge and make a career out of it.
And has it fulfilled all your hopes and dreams?
Yes, to this point.
What's the most fulfilling part about EP?
I just love working with people. I love seeing little wins along the way, things as simple as someone being able to get out of a chair with ease, to big wins, people being able to have surgeries that they're after or improve their health so that they can do things with their family, to recovery from, rehab from neurological conditions. I've seen someone walk for the first time in 20 years and that was pretty awesome.
Some of the most amazing things I've seen in my 20 odd years in, the health industry are the effects that you can have on people, the way that you can change people's function over time, the impact it has on their ability to get out in the community, their mental health, their emotional well-being, their physical well-being. Like, it's not just being able to get out of a chair, it opens up so many opportunities for them in life that had previously been shut down for them. The last couple of years with you it's been staggering watching a lot of this stuff occur under our roof, and it's been incredibly fulfilling. And one of the major reasons why we kind of created this space at o-health was to allow this active-based rehab to occur, and also to kind of have that continuity of care with people, to actually take people through from acute pain or acute injury through to really restoring incredibly high levels of function beyond what they thought was possible in the first place. I'm not sure if you've got any comments on that, but it's certainly been incredibly gratifying from our perspective.
Yeah, I think something that's just fantastic to see is improvements to just daily function. People being able to do their life tasks easier, as well as now we're seeing a lot of improvements to sort of mental health as well. That's becoming more recognised, which is great.
Yep. Who do you typically work with? Like, what type of, people, but also what type of injuries or illness or conditions do you work with?
So generally we work with chronic conditions, whether that's injuries, illness or disability.
What does chronic mean?
So this means anything that has been either going on for a long time or is a lifelong.
Yep.
So scope is very, very broad. I guess we can sort of break it down into a few areas, being cardiac conditions, so anything to do with the heart, neurological, which might include things like Parkinson's disease.
So with cardiac, we're talking about hypertension, high blood pressure, post-stroke?
Yes, as well as post heart attack as well, that's a big one, or for people that are at risk of reoccurring heart attack. So then we go into sort of those neurological conditions as well, including motor neuron disease, Parkinson's, very, very broad again. And then we can look at muscle conditions, so post-surgery, pre-surgery, post-surgery, arthritis, anything within that area, as well as for individuals with intellectual disabilities, and for mental health as well.
Yeah, so with, just to unpack this a little bit more, I guess with the disability sector, you're talking about working in the NDIS and you're qualified to do that and you get funding and all of those sorts of things? So we do work with people through NDIS. Generally the goal with that is actually, looking at how we can improve function so people can get out into the community, they can do things at home easier. It's actually about bringing it back to, improving quality of life and general day-to-day function. Yep, and safety in the home too.
Yeah.
People being able to get up from the floor if they happen to fall over and not having a lower risk of falls. And we know that these things are really big predictors for kind of ill health and real challenges often in later life, but can be any stage of life. And EP can play an enormous role in preventing some of this from occurring as well as managing it once it has.
Yeah, exactly. Another thing that I should actually touch on is education in that area as well. Educating people, and especially with sort of within the NDIS space, we see adolescents with ASD, and a big part of that is education and making exercise fun and feel safe so that it's actually something that is sustainable for them, finding ways to exercise that they enjoy so that they want to continue, and that actually sets up healthy habits for later down in life.
And in terms of being accessible, I guess, to patients with, they might have mobility issues and those sorts of things, is there any barriers to people coming in to o-health and particularly into the EP space?
I would hope not.
Yeah.
It's we've got a fully accessible clinic, wide walkways, lovely people to support along the way. We've got, equipment like the rails and a large plinth, a bike that's generally quite easy to get on and off. We've got equipment to set it up so that people feel comfortable to come in.
Yep, and it's always safe.
Yep.
Yeah. Righto. I guess, what does a consult look like? So if someone comes in as a new patient, what does it look like?
Yeah, so like any of the other services that we have here, people come in and do an initial assessment. In that time, we'll have a chat through medical history. That's really important so that we are aware of anything that could be going on so that you're always safe when we do get to the exercise side of things. I guess with that, the more we know about the person that's there, the better plan that we can come up with. So talk through medical history, a bit of social history, what do they like, what don't they like.
Because there's no point prescribing exercise or creating exercises for people that they don't like doing.
No. We know that doesn't work.
Yep.
So a big part of what we do is actually finding ways that people enjoy exercise so that it's something they will go on with. Have a chat through goals, previous exercise history, and then come up with a bit of a plan on where we go to from there.
Yep.
So it's all very individualised. There's no expectations on where anyone should be or what they should be able to do when they come in. It's certainly not like that. We work with the person to set it up.
How long does it take?
45-minute initial is fairly standard, and then follow-up consults from there, generally between the 30 minutes to 60 minutes, depending on what's needed and what someone can tolerate through that time.
Do I get undressed?
No, you don't.
No?
No.
What do I wear?
We say just wear clothes and shoes is generally safest, and comfortable clothes. What can you move in? Doesn't have to be, top sporty clothes. It can be anything. Anything that you're comfortable in and that you can move in. And bring a drink bottle.
Will you touch me?
No. Well, depends.
Yep.
It depends on what someone's coming in for. We need to do any testing. We'll always ask for permission before we do. But in some instances, people will need help with getting on and off the bed or...
So this is a bit of a loaded question, clearly, because there's often a bit of confusion between physio, osteo, EP.
Yeah.
So I guess one of the key differences is that you're not touching people in a therapeutic way necessarily, like
correct.
we would with as an osteo. That's what we do, and physios. That's not something you do.
No, it's not.
No.
So we don't do any manual therapy. It's all exercise-based rehab. Yeah.
No, really good. All right. Thank you.